Assalamu alaikum, welcome to all. Today we'll be performing an examination of the abdomen together with some associated examinations. So we'll begin with the usual greetings, introduction, consent, exposure and positioning. So let's begin. To begin inspection, the abdomen is observed in two planes, from the sides and from the foot end of the bed. Following this, the abdomen is examined for its overall shape, size, any swelling, umbilicus, flanks, hair distribution, overall skin condition, etc. To check the hernial orifice, the patient is asked to turn his face to the opposite side and cough. Before commencing superficial palpation, ask the patient to localize any abdominal pain and begin palpating away from this site. Check for any lumps or tenderness in each region. Check for any raised temperature in the painful region. Next, we perform the deep palpation. Gently command the patient to turn his face to the opposite side and breathe deeply through his mouth. Palpate the abdomen during inspiration by flexing your fingers at the metacarpophalangeal joints and advance your hand during expiration. Place your hand in the right iliac fossa parallel to the costal margin. Command the patient to turn left and breathe in deeply through the mouth. Advance 1 to 2 centimeters upwards on each expiration. Alternatively, the liver can be palpated using both hands in a dipping technique like this. The upper border of liver dullness and gallbladder tenderness are described in separate videos. Now, to palpate the spleen, fix your left hand along the lower left ribs and palpate diagonally from below the umbilicus using your right hand towards the left hypochondrium. For better palpation, the patient is turned towards the right side and the process repeated. Make sure to feel for a notch along the anterior border and insinuate your fingers along the left costal margin. Now, with the patient supine, bimanually palpate the kidneys with the left hand placed on the patient's back and the right hand anteriorly like this. If enlarged, perform ballotment as well. Next, deeply palpate the para-aortic lymph nodes on each side of the abdominal aorta above the umbilicus. Sequentially, palpate the urinary bladder after asking the patient if they have voided or not. An empty bladder is impalpable. With the patient supine, start percussing from below the xiphisternum to the umbilicus. Then go outwards to the right flank. And if dullness is present, keep your finger on the same spot and command the patient to turn to the left. Wait for 10 seconds to allow the ascitic fluid to gravitate. Now start percussing to the opposite side. Make sure to note any changes in the character of the percussion note. Place your left hand on the left side of the patient's abdomen and flick one of your right fingers on the opposite wall. If you feel a ripple, ask the patient to place the ulnar border of his hand on the midline, preventing transmission of any fat impulse. If you still feel a ripple, fluid thrill is present.